My name's David Sloan. I'm a licensed mental health counselor here at Recovery Associates. I'm also the head of the traditional track. On the traditional track, we focus on 12-step recovery. My specialty is looking at addiction or addiction treatment through a cognitive viewpoint. And what I believe is that we can teach people how to develop some self-help techniques like calling a sponsor, going to meetings, reading literature, developing healthy peer groups. But if we don't really take a look at some of the beliefs that surround the addiction, then it's a good chance that some of these addictive behaviors could come back. So what I try to focus on is helping the client to recognize when they're experiencing a craving, which is a little bit different than an urge. A craving is when somebody just has the desire for the positive effect of something. It could be chocolate, it could be going to the beach, it could be working out. But with addiction, we want to look at the cravings or the desire just to have a positive effect from the drug, which is a little bit different than having an urge. An urge is more of kind of a physiological response where the person has this kind of internal push to go seek the drug. So if we could get to a point where a person really kind of understands the difference between cravings and urges and help them to recognize when they experience that and intervene before they act out on the urges, then in many ways we could reduce the amount of relapse that we have. Some of the ways that people can reduce the acting out on the cravings and the urges is to develop or use some of these self-help techniques. Now, along with understanding what cravings and urges, the difference between those two things is to understand a person's beliefs about drugs. It's my understanding and my belief that all of us have different beliefs about drugs and alcohol. Understanding and identifying what those beliefs are for the particular person that I'm working with and helping them take a look at that belief is part of the goal for therapy. If they can take a look at that belief and see if they're gathering all the additional information or all the available information that might be present and helping them weigh that in their decision with the belief, in many ways could reduce the effect that this belief has on their cravings and their urges. In other words, one of these beliefs could be, I can't have fun if I don't use, I can't deal with my anxiety or depression unless I use something. So that's also part of one of the things that I do in therapy along with this cognitive perspective is to help them look at the addiction but to also look at the emotional piece that's tied in with the addiction. So people that come in could deal with higher levels of anxiety or more self-critical thinking that's usually associated with more depression-like states. And it's kind of like a puzzle. If a person can kind of take a look and recognize some of the things that they believe and some of the things that they say to themselves, in many ways we can reduce the amount of anxiety, reduce the amount of maybe depression-like symptoms that can fuel the need to use a drug that could increase the cravings and the urges.